The root canal procedure is a procedure in the dental field that is frequently misunderstood and distrusted by a lot of. But it's an essential procedure that could help save teeth from being extracted and ease pain due to an infection or damage to the pulp of the tooth. In this short video, we'll look at how root canal therapy can save your tooth step by step. Step 1. Diagnosis. The initial step to save teeth that require root canal therapy is identifying the issue. The dentist will inspect the tooth and possibly perform x-rays to see if the pulp of your tooth, that is composed of blood vessels, nerves, and connective tissue, is inflamed or infected. It could be due to the deep decay of the tooth, cracks in the tooth, frequent dental treatments to the tooth, or even trauma on the tooth. Step 2. Anesthesia. Prior to the procedure commences, the dentist will apply local anesthesia in order to relax the region around the afflicted tooth. It will make sure you're comfortable during the process and you won't feel any discomfort. Step 3. Removing the infected pulp. After you've been numb, the dentist can make an opening within the tooth in order to reach the affected pulp. The affected or inflamed pulp will then be removed with specific instruments. The root canal is cleaned and disinfected in order to get rid of the bacteria and other debris. Step 4. Filling the root canal. When the root canal has been cleaned, it's lined with a material similar to rubber known as gutta percha to avoid contamination of the tooth. The material seals the root canal to prevent bacteria from entering the canal and leading to an infections. Step 5. Restoring the tooth. After the root canal has been completed, the dentist will put an interim filling or crown over the tooth in order to safeguard the tooth until a permanent replacement is created. In certain situations, the need for a crown on a tooth may be required to repair the strength of your tooth and its function. Step 6. Follow-up. Once the root canal procedure has been completed, it's crucial to visit your dentist regularly for checkups and exams. This ensures that the tooth is healed well and any indications of complications or infection are treated promptly. In the end, root canal therapy is an essential procedure that could protect your tooth from removal and ease pain due to injury or infection to the pulp of your tooth. If you follow these guidelines to ensure your tooth will be saved and returned to optimal condition. If you're experiencing tooth pain or think you might require an extraction, speak with your dentist about the options for treatment. Be aware that early intervention is crucial to saving your tooth as well as keeping your smile healthy.